Hey guys, this is Coach Bill with Bill Mabry Online Coaching. Hope you guys are having a great, what is today? Wednesday. Um, I guess they call this hump day, I guess. Anyway, let me get these pop-ups off real quick and let me start my clock and we'll get started with the topic. So today, guys, this is a topic that is probably going to be around a while until the health professionals who or even doctors can get more information, scientific information showing the benefits of the two programs that Emily and I teach on our online coaching. So the topic today is misinformation about a true ketogenic meals. And this is a big topic because it's true. There's a lot of misinformation about the health benefits of being on a true ketogenic diet. Now, from my experience in the last few years, when asking questions, when I'm doing a free consultation, I'm getting this all the time that I've heard people say, well, I did the ketogenic meal plan and it didn't work for me. My doctor says it's not a healthy way lifestyle, or just doesn't work. Well, it's because most all of them did it wrong. They're not doing a true ketogenic diet. Guys, the misinformation about the ketogenic meals being unhealthy lifestyle, is something that most of the public seems to think that is true. And I'm going to tell you right up front right now, it's not true. Guys, you got to understand that the ketogenic lifestyle has been around for centuries. This is not a fad diet. It's been a diet around for centuries. Actually, in 1970 is when the Food Administration introduced the low-fat, high-carb meal plan. And after all these years, obviously that didn't work because why? Because obesity, type 2 diabetes, insulin resistance, and fatty liver disease right now. And of course, belly fat is an epidemic among the young and old. So, what is the reasoning? Why are these health professionals, or why are these people, or some of these doctors actually giving out misinformation about the health benefits of a ketogenic diet? Is because of lack of education, guys. That's the biggest thing. Because if you really knew how to research science, then you would see all the science that's coming out, all the new science that's coming out like every month or every 2 months, showing the health benefits of being on a true ketogenic meal plan for many health diseases. Many health diseases. And now there's actually doctors that are actually using the ketogenic meals to help their cancer patients because they're finding out that cancer just does not survive on fat. It can't survive on fat. And so there's new information, science coming out about this all the time. I just saw a seminar where a doctor, researchers is saying that there's a lot of brand new research that are being conducted, which are clinical trials. Those are true science research. There's a lot of new clinical trials that are going through right now because now a lot of doctors are seeing the benefits of a true ketogenic diet with their patients. And why are they now seeing it? It's pretty simple. Because blood tests don't lie. You know, here at Bill Mabry Online Coaching, how do we monitor that you're actually in a ketosis or fat burning 24/7? Well, blood tests don't lie with that either. You're doing a blood glucose reading and a ketone reading. That's how we know you're actually in ketosis, or what we like to also call autophagy. But what's happened here, guys, is that the food market or the food marketing companies are taking the ketogenic meals, which are showing some really unbelievable health benefits. And what they're doing is they're jumping on board because it's so popular today because of all the science, because more doctors are now seeing the truth behind the blood test, showing how these meals actually help. What they're doing is the food marketing is actually producing ketogenic meals and calling them keto-friendly meals. And guys, they are not. They are not keto-friendly meals because why? Because they're processed. They have to sit on the shelf for a while before they're bought, right? So they have to put something in those meals in order to get them to last long enough before they're bought. And besides, if you look at the ingredients, they're not keto friendly at all. They're gonna spike your insulin. And how do we know? Because that's why we do a blood glucose levels, and that's why we do blood ketone levels, to make sure that the food we're eating is not throwing us out of ketosis or not throwing us out of autophagy. Guys, they're processed. You know, the supplement companies also are jumping on board. Now they have these pills that say they're going to put you in ketosis by taking the pill. The object, guys, is to teach your body to switch from being a carb burner for its primary energy source to being a fat burner. That's the whole objective here. There are steps you have to follow, though. You still have to teach your body how to burn fat, and that's why you want to go on a ketogenic meal plan, is to teach your body how to burn fat. Once you've been doing this a while and your glucose levels are dropped and your ketones are up, then wouldn't it make more sense to want to burn your own stored body fat to be in ketosis instead of having a pill? No, yeah, exactly. So what that pill is just it's not really doing any good as far as burning your own stored body fat. Let me give you an example. Last week or a couple of weeks ago, I had a cardiologist with one of my clients, and they told him that the meal plan that they were on, the cardiologist wasn't really enthused about ketogenic meals because why? Because he wasn't really educated in it. But he heard other professionals or other people talk about how it's not a healthy lifestyle, so he's telling them the same thing. Well, guess what? After he read the blood test of his client, or of his patient, he actually came back with an email to my client stating, you know what? It looks like this ketogenic meal plan and the intermittent fasting you're doing with it is actually working. Then he sent a second email to my client and said, whatever you guys are doing, keep doing it. It looks like Bill Mabry online coaching program is working. You see, that's all it takes, guys. All it takes is for these professionals, or even those of us that are in the public that know how to research. Go to a real research site. Do the journal, the case studies, the double-blind trials. Those are the ones you want to look at. And on both the ketogenic meals and intermittent fasting, there is so much information out there, so much science. It can't be denied by any doctors, and besides, blood tests don't lie. Okay? So guys, don't let somebody tell you that the ketogenic meal plan is not a healthy lifestyle. It actually is. Both the ketogenic meals and the intermittent fasting have been around for centuries. There's been books written about it hundreds of years ago. But yet, the public and the health professionals still are not taking the initiative to look into it to themselves. All they're doing is letting somebody who is not a ketogenic meal plan specialist or who is not an intermittent fasting specialist, they're listening to uneducated people that have no right to give any information, be negative about this meal plan because they have no education in it at all. And it's what they're giving is actually hurting the public. And now many doctors can see the benefits. So guys, my time is up. I hope you saw some value in this. Go to my BillMabryOnlineCoaching.com. Check my website out. You guys have a great day.